Welcome to Dignity Health Social TV. Today we're talking to family practice OB, Dr. Leininger. We're talking about breastfeeding medicine and something that you're passionate about. What type of patient do you see and what type of care do you offer?
So I'm a family physician with an obstetrics fellowship, so I see mom through prenatal care and then I see babies and continue to see the family after that. I have a newfound appreciation for breastfeeding, having had my own son and realizing that as a family physician, I didn't get a whole lot of breastfeeding training and that the average pediatrician and obstetrician doesn't get a whole lot of formal breastfeeding education during training. So I've sought out extra training, becoming a lactation consultant to better help my patients, in that really difficult early stage when you're figuring out breastfeeding and when failure feels like a huge failure and a lot of people quit breastfeeding.
What does the lactation specialist or consultant do and how do they serve the parent?
So lactation consultants work both in the hospital and outpatient, helping moms and babies figure out breastfeeding. Breastfeeding's natural, but it doesn't come easy to all moms and babies. And it's a learned behavior that takes a couple weeks to really get going well.
And so what would some of your recommendations be for new moms, new parents breastfeeding? What are some things that you would suggest for them to consider?
So we know that breastfeeding success starts in prenatal care. So the obstetrician or prenatal provider talking to their patients about breastfeeding and their goals with breastfeeding and talking to them about the goals of being up to a year. Okay. And patients, we usually have decided by the time they're halfway through their pregnancy, if they're going to breastfeed or not. So the earlier we talk to our patients, the more likely they're going to breastfeed for the recommended period of time. Breastfeeding classes and childbirth classes both talk about breastfeeding, and then, support right after delivery, early skin-to-skin contact for the first hour, initiating breastfeeding within that first hour after baby's born, avoiding pacifiers, avoiding formula supplementation in the hospital. That kind of thing really sets mom and baby up for success.
So there is help for those that are trying to figure it out, wondering what's going on. There's a lot of people wanting to encourage new moms and parents in raising their children and loving on their children.
Yeah, there's a lot of help.
Thank you so much,
Thank
Dr.
you.
Leininger. Thank you for watching Dignity Health Social TV. For more information, you can visit mercy.org.